So thank you very much. So FACES is in the 10th year now, believe it or not. And so some of you may have heard about it by now. But I'll try to bring you up to date with some of where we are, or at least one piece of it. This is a huge study. There are dozens of people who've worked on it. These are just the really top-level investigators. Ira Tager, of course, is the principal investigator. And many of the people listed here are here at the meeting today. And these include Jennifer Mann, Dave Vaughn, John Balms, and Fred Lerman. You'll be hearing from Jennifer and Fred a little later. Also, Leah Mendelez and Cindy Eppel are here. They're the real worker bees. They're really out there meeting with people and very important people in the study. And of course, there's the laboratory. These are some of the people from my laboratory. I just want to recognize that this is not all my work by any stretch of the imagination, but this is a collaborative effort. So the question would be, there have been many studies that have indicated there's a relationship between particulate matter and asthma. So why do the FACES study? What's the reason for that study? And basically, we have very little data on which asthmatics are susceptible to which air pollutants. And our goal is also to explore in detail particular air pollutants. This is really getting to from the science to the policy. We don't want to be regulating the wrong components of the particulate matter. We want to understand, we're looking at the composition, and we want to look at that in detail. And also we're looking at some of the relationship between short-term exposure, short-term immediate response, and then long-term prognosis of asthma in children. So fundamentally, FACES is focused on the determination of the effects of chronic exposure to air pollution in combination with bioaerosols on the progression of childhood asthma. We basically recruited 315 children who were between the ages of 6 and 11. We've done some extensive air quality monitoring. We're monitoring the symptoms and lung functions in the children. There are office visits involved with these children, and we have collected data for 8 years, from 2000 to 2008. All right, and so I'm going to give you a very quick overview of the health part of the study, but my major focus is to talk about the exposure assessment here. So there's a baseline health examination that's done at the beginning of the study, including spirometry and also skin testing. And then there are every 6 months there are follow-up clinic visits, and every 3 months a telephone survey. In addition, in the first few years of the study, the first 5 years, the children participated in 2-week panels where every day, twice a day, they did a little pulmonary function testing and they recorded their symptoms of medication use. So what we're trying to look at here, very briefly, is going from short-term exposure to what is the acute exacerbation of asthma, and then over time,